welcome to Posture Positive, the launch of Posture Positive, which is an initiative all focused on providing excellence in postural care to change the lives of people with learning disabilities. We're so excited that you have joined us this morning. There's lots of people, lots of attendees. Please use the chat. I'm sure we're all zoomed up these days, aren't we? Everybody has been well and truly zoomed, but please introduce yourself on the chat, and we'll be using that. We'll be using polls. We'll be people will be monitoring the chat, and we'll be able to share any of the information that we've gathered from that chat as we go along. So I'm going to introduce myself first of all. My name is Rachel. I am a nurse by trade, by qualification. I am the founder of Born at the Right Time, and I am the author of The Skies Are Munda. I'm also the parent of 3 boys. I've got Sam, Ethan and JJ. Sam is very severely disabled, and so this project is so personal, as well as from a nursing perspective. Looking after bodies and caring for people is really important to me. And I was dragged into this project, kicking and screaming, not really, by Sarah Clayton. Sarah, tell us all about yourself.
So thanks, Rachel. I'm Sarah. People know me from my work with Simple Stuff Works. I have been around postural care since before, well, for forever. I found an old photo the other day of me kind of 8 years old in a multi-adjustable armchair. So I've grown up around postural care. I'm John and Liz Goldsmith's oldest daughter, and I have 4 children, and my oldest Abby has a complex brain injury. Now, I was really keen when NHS England approached me. David Harling is the man to thank with regards to this whole project, and David can't be with us today because the Deputy Chief Nursing Officer has COVID, as do some of his colleagues, and he's having to deputise for them. So he sends his apologies, but he's an absolute legend and has supported this project from the beginning. But I really wanted to work with Rachel on this because whilst my family accesses lots of different services with Abby, whilst we have used postural care in the past at different stages along her, with her illness, I don't live it like Rachel does. Okay, so that's why I wanted to work with Rachel on the project. And I think it's back over to you, Rachel.
It is. I want to say, so we were really passionate about getting as many voices of the different people that are affected by postural care in our project. And so we sent out surveys. Sarah will tell you lots more about the surveys that we sent out. But we didn't really manage to capture the most important voice, and the most important voice are the young people, the children and the adults who have got learning disabilities and have got postural care needs. And because we wanted to put that voice front and center of everything we do in the next 45 minutes and for the days and weeks and months to come, I'm going to share with you Luke. Luke was on the BBC special school series, and so we're just going to show you 1 minute of this very, very short clip. To
time, he still from somewhere seems to manage to pull himself out of it, and not feel sorry for himself, and to get on with things the best he can. And it's amazing to see him develop into this strong, emotionally strong young man that he is turning out to be.
I don't like being trapped in my chair.
No. Now you can tell people that.
But there's more to it, though. With the belt, something to do with the belt? Legs?
Is it to do with your tummy, Luke? No.
No.
Is it to do with lower down? Yes.
Is it to do with catheterising, not being able to go to the toilet? The fact that you have to be catheterised and you can't go to the toilet. You don't like having to have that done? Yeah. Are you happy for people to know that's the kind of things you have to go through, and that's what you want people to know? Is it's not just the being trapped in a wheelchair, it's all that other stuff that you've got to go through. Do you want me to put that on there as well? Yeah.
He's always coped really well, up until the last few years, he asks more questions and he worries about his health a lot more.
So really powerful there. And we are really conscious that this project doesn't capture the voices of the people who postural care impacts most. So with that in mind, and with the complexity of capturing that voice in mind, and with a plea to anybody that can out there to you know, that we really need the research to capture that voice that we were unable to. With that in mind, we want to explain what we were able to do. So we started off in late August. So this project has been time pressured from the very beginning. And we started in late August developing a survey. The first survey was 15 open questions. We were looking at which services have been impacted by postural care, you know, by COVID, what the impact of that was, and then, you know, helping people to look to the future. There were we had 4 surveys, one for people with learning disabilities, which we commissioned an easy read version of, one for families, carers, paid support workers, which for the purposes of the report we've called families, so people that are providing hands-on care, practitioners, so physiotherapists, occupational therapists, industry, and also commissioners. And Rachel will talk through the findings of that, but we had 89 responses in total. And based on that, so for the families, they were supporting people from age 2 all the way through to 39. 11 people were over the age of 18, so we had more children than we did adults. And the families were all had an OT or a physio, and 90% had both an OT and a physio. And then based on the results of that first survey, we developed a second survey, which was 2 closed questions. And the first was looking at the innovations that had been shared within the first survey, for people to prioritise those. Which of those innovations did they feel might be most effective? And the second was, which were your preferred methods of communicating during COVID and beyond? And Rachel's going to go on now and explain the findings. What did people tell us when we asked them about postural care during COVID?
Just before I do that, Sarah, can I just say to everybody, down on the chat there, you've got 2 options. You've got to panelists and to panelists and attendees. If you want everybody to see what you're saying on the chat, make sure your little blue box says panelists and attendees so that everyone can see. So we got views from lots of different people, and we've got lots of people I've seen on the chat there. We've got lots of people from all around the world, and we got responses from all around the world. Is there, Ed, if you want to introduce yourself in the chat, please do, whilst I tell you a little bit more about this report.
I forgot to say, well reminded, Rachel, I forgot to say that for the purposes of the analysis, whilst we welcomed those responses from people all over the world, we did remove them from the analysis. So the analysis is just people from England.
What we did really is we took all your wonderful ideas.
Yeah, we did that.
But we just didn't do it to analyse the service provision for people within England, because that kind of wouldn't be very fair. So what did the surveys show us? The surveys, we had a fantastic response, like Sarah said, both from families and from practitioners. And out of the accumulation of both of those groups of responses, we got 5 specific themes, 5 general themes emerged from the data. There was monitoring outcomes, reduction in service provision, the structure of the service, adaptation to the crisis, and negative health impacts. And I'm going to go through these one at a time, but we're going to do a whiz through it. You will have given the link, and we can share that link with you again, but please share where you can find the report is on the website, and we will go through it lots more detail in the report. But monitoring outcomes, what did it say? Well, basically, the most important thing it said was that families knew why they were doing postural care. high five to the families. You're doing it because you want to provide your child comfort, or the adult that you're caring for comfort. You're doing it to maintain their body shape and to support function. There was 15% of practitioners who used an objective measuring tool. So that's a tool that, rather than just what the parents and most of the practitioners do, is look at the body and say, yep, it's still nice and straight. There are tools out there within which you can measure whether the symmetry of someone's body is in line or not. And so small changes that maybe you can't see visually can be objectively measured and then compared. And it gives us a really good indication as to whether or not what we're doing, because it's hard work and it's relentless, whether what we're doing is working or not. So most of the families, like Sarah said, had 3 pieces of equipment, but less than 30% of them reported that they had the use of these 3 things: wheelchair, supportive seating, and night positioning. Why those 3 things? Those 3 things interest me as a parent of a child with really complex needs, because when I think of my son's 24-hour posture, we talk about 24-hour postural care. When I think about his 24 hours of posture, it needs to have all those 3 things. All right, in order to cover the bulk of his day. Yes, he goes in a stander. Yes, he goes in a walker. Yes, I get him on his front, I'm on his back playing and all those things, and he gets in the pool. But those things last for shorter periods of time. The amount of time he spends in a wheelchair is a considerable amount of time. Then there's the supportive seating, and then there's the position he's in at night. All of those 3 things I recognise as a parent, and the legislation and the kind of recommendations from people like Public Health England recognise that those things are also important. Families and practitioners both identified that it isn't just, postural care isn't just a cherry on a cake, it's the ingredients, it's this flour and eggs of the cake that is caring for someone with postural care, and it is vitally important that we do it. So what we just brought out from those results is that there is the lack of 24-hour postural care without clear outcomes and monitoring is potentially creating gaps, presenting holes in our defence against this potentially life-changing, the negative impacts of poor postural care. So the next thing, reduction in service provision. Well, we didn't need a project to tell us that, did we? Because with isolation, with redeployment, with remote working, social distancing, the world stood still, didn't it? And it's, again, the urgent services were the things that were maintained, and families found this really crippling. It was it was the theme of feeling abandoned and isolated was so palpable in so many of the responses, and it was really difficult to hear. Services had to reduce capacity in a very abrupt, short-term way across the board, and it left families feeling less supported. And the way in which those services adapted to that change really varied dramatically. And then there was the structure of the service. It came across from practitioners and families that COVID-19 kind of revealed like there were current service structures that just weren't as robust as they could be. There was a fragility that under the strain, the immense strain, it couldn't withstand. Some people said that it was the whole reason for COVID stopping services providing was a little bit of a red herring. That was something that came across not just from 1 or 2, but from various people. But people were working incredibly hard. Families were working incredibly hard. Practitioners were working incredibly hard. And there was 3 things that the structure appeared to be impacting the way provision was delivered. First of all, the coordination, the lack of communication between practitioners and families. People with learning disabilities and their families need more coordinated approaches, said one practitioner. Another practitioner talked to with regards to funding. It's confusing for professionals, never mind the families, knowing who to go to get pieces of equipment in order to support for your child, or therapies and everything else. And the third thing that came across was coaching and empowering families. It was really clear that when practitioners could no longer have hands-on, it was down to people like me and my peers who were there 24 hours a day looking after our loved ones. And it was apparent that the impact of COVID-19 highlighted pre-existing fault lines within postural care provision, in particular, the way it coaches and empowers families, how it's coordinated, and how it's funded. But there was an adaptation to the practice. That's another thing that came through in our findings. We like to call this silver linings, okay? There was 3 things that really stood out. The benefits of online virtual clinics. Up 50%, both of the families and of the practitioners in our second survey, 50% of them said, this is how I prefer to communicate with my whoever it is we need to speak to, whether it's the practitioners to the families or the families to practitioners. There was a massive increase in the use of this online technology, and just adapting to that technology took an awful lot of work and dedication of the practitioners who were serving families. Then there was rallying. I love this quote from one practitioner. I found that there's a feeling that everyone is pulling together in the pandemic to support the child. It's given us time to actually hear the voice of the family. And there's this feeling that we're all in this together. We found a common vulnerability which helps us to see each other as a human and takes away the barriers of who's teacher, parent, and therapist. Wouldn't it be fantastic to take that beyond COVID into our everyday lives? And there was really encouraging signs of resilience, of the service adapting, of the service changing and embracing new things. Amidst a time of rapid transition, we propose within this report, maybe this is the time that we could implement real transformation. Maybe even though we're a bit scared and we're daunted and we're all a little bit overwhelmed, we could actually be improving postural care and make it more sustainable and resilient for the future. Sadly, the last one, and the one that came through and was most painful to read, was the negative health impacts. And it wasn't just 1 or 2 people, but every single group of people represented within our survey showed the negative health impacts, whether it was the practitioners who really missed that contact with families and the people that they were determined to serve and to help. And that had an impact on their own mental health. Then there was immediately from both sides, families and practitioners recognized the impact, the negative health impact on the families, those people who were suddenly left unsupported, desperately trying to look after people with postural care needs. Some people found it, as one parent painfully said, it's heartbreaking to see. I felt like I'm watching a car crash and there's nothing I can do and no one cares. But the people who were the most affected, as is often the case when things go wrong, when we need to hunker down, when things become challenging, the people most affected were the people that were the most vulnerable, the people with learning disabilities and postural care needs. And families and practitioners recognised that there was increased pain, there was increased body shape changes, there was deformity in people's bodies, which happened that did not need to happen as a result. Nearly 80% of practitioners identified ways in which individuals' health was not only negatively impacted now, but would be negatively impacted in the future. And here's the thing. When we talk about safeguarding, which is a scary word that makes me, and I think many other people that are listening, go, safeguarding is about protecting the vulnerable. It's about protecting people from harm. And when we talk about safeguarding and postural care, it is not just a family's responsibility, a single parent's responsibility. It's not a practitioner's responsibility. What we call for within this posture positive collective report is that safeguarding is crucial in postural care provision. It's a collective responsibility of us, the whole system, to work together to protect individuals with learning disabilities from harm. Very quickly, this is the pie charts that talk about the fact that 50%, not just the practitioners, but families as well, both see the benefit and prefer virtual online clinics to to all the other methods we've used in the past. So what came across that second survey is it just reinforced what came across in the first survey. The fact is, when people envisaged and dreamed about doing things better, they looked at how postural care is funded, how it's coordinated, how families and practitioners work together, training and accessible information. Those things are key to improving the lives of people with postural care and learning disabilities.
Okay, so look at me. This is doing two things at once. So I'm looking at the chat. Annie, I can tell you that it was 89 total responses, the majority of which it was about half and half between families and practitioners. 89
in the first survey, 53
yeah, 53 in the second.
Put them all together, it's over 100.
There you go. And if we think about the people that were from overseas as well, the numbers go up again. But obviously we had to exclude all of those for the analysis. Now, we said that we were going to talk to you today about the what, the so what, and the now what. And so we're going to spend just a little bit of time. Rachel has outlined the what, and you can read that in much more detail in the report, and it makes really tough reading. And we have to reflect on so what, on how does that make us feel? Because in part, the response to what people told us in the surveys, the response comes from how it makes us feel. So we might hear those, all of those kind of overwhelmingly negative experiences of people, and it can do different things to different people, can't it? For some people, they might feel really despondent and think, well, do you know what? I've worked really, really hard and it's made no difference and things are still awful. Or it could make you feel quite feisty. And it could make you say, do you know what, I've worked really hard and it's still not working. What can I do? What next? So we're just going to take a moment. First of all, we would like to just share how the so what made us feel. We did 2 weeks and it is, you know, I'm smiling because I look back at it and it was so tough getting these responses and thinking, how do we do justice to the people who have shared intimate aspects of their lives and let us know just how difficult things are for them at the moment, without adding to what we could quite clearly see from both practitioners and families, you know, were some really significant mental health issues and feelings of you know, kind of overwhelm. Now, luckily, now before I go on to introduce you to Lucy, I want to ask you, you know, bearing in mind those, how are you feeling? Now, you can tick as many as you like. We're not allowed to vote, but you can tick as many as you like. And when we did this in practice this morning, 50% of the people we were practicing with got a poll and 50% of the people didn't. So hopefully you'll be able to see those questions in front of you. So if you would like to, it's completely anonymous, but if you would like to, then you can just tick as many as you like.
I feel like I'm watching, we're up to 25 out of the about a quarter of the 30% of people have now voted. I feel like, could I do like a sort of racehorse kind of, and they're coming up to the end and they're around the end bend and we're halfway through, nearly who's going to win? Oh, it's neck and neck. It's neck and neck. Come on.
We can't see these results.
No, I know you can't see the results, but I'm just encouraging you, okay? Just okay. Take my encouraging tones and just go with it. See what I have to live with.
Sorry to the people, there's a couple of people in the chat saying no poll appearing. We have no clue why that is. Because we are really sorry. We tried it.
Other people have got polls because I can see them. I'm really, really sorry. Right, I'm going to do it.
Do it.
5, 4, 3, 2, 1. I've ended the poll. I'm going to share the results with you all. And I've got to say, I'm very excited that people are optimistic. Yeah, overwhelmingly optimistic. I think if we had the option to contribute, Sarah and I would be able to be optimistic, but we also might be saying that we're a little bit anxious as well.
Not tiny bit. Tiny bit anxious. Okay, so we're going to move on now to hear from the other member of our team, who is a fabulous, fabulous woman called Lucy, Lucy has a psychology background, and as Rachel said at the beginning, while she and I plough on, she is constantly asking us to take a step back and think about how things make us feel. And she was hugely, hugely supportive and helpful in helping us to see how we can take this forward.
Good morning. So you've heard from Rachel and Sarah about the findings of the Posture Positive survey. And I realise it can be really hard when we hear yet another report about how difficult things are. We've probably all heard many such a report in our careers as practitioners or our role as parents. And I completely understand how that might feel quite hopeless and trigger a sense of helplessness about how we can change things for the better. So what I want to talk to you about briefly now is the now what. What do we do next? How do we make sure these findings don't just slip into being another report on the pile of endless reports about how awful life is for disabled people and their families? How do we affect positive change going forward together? Firstly, let me say, I think this is everyone's responsibility. And I realise that might cause some of you parents out there to feel frustrated, another thing to do, another battle to face. I empathise entirely. As the parent of a child with complex needs, my life is far too full of stressful things. Thank you very much. I do not need anything added to my to-do list. I totally hear you. For professionals, there's probably an equivalent response. You find yourselves having to work in strange new ways in a strange new world during a most unforeseen and challenging scenario. Although on the upside, I'm sure we all have found new appreciation for being able to wear nothing but pants on our bottom halves for the majority of the working day. Everyone has shown incredible resilience, and that's really what I want to focus on in relation to next steps. Building resilience together. It can be really easy to think about resilience as this within-person superpower. And the problem with that narrative is that it can become very isolating very quickly. If resilience is all about individually digging deep and toughing it out, you really quickly get too tired and too burnt out. In this framing of resilience, we can feel as though the system is too big and too challenging. It's overwhelming to think about how on earth we can begin to change things when we're barely treading water ourselves. It can feel as though nothing is within our locus of control because we're doing everything just to get through the day. And the system over there is something way beyond ourselves, something fixed and rigid that we end up in a futile battle with because it feels like there's nothing within our control to change. We also know from psychology that when we feel out of control and hopeless, we learn to be helpless. People don't change things when they feel hopeless and helpless. We get stuck in this cycle. We know too that when we feel isolated, we lack that sense of belonging that's so important for us as humans. Maslow suggested belonging was a basic human need, and without it, we can't do that higher order stuff of thinking about change. So what can we do? Let's start to think about resilience as less of a within-person superpower and more of a systemic endeavour. Because when we think about it that way, as something that makes whole systems bounce backable in the face of challenge, then we start to realise we are not on our own. We need to shift from seeing ourselves as out there and separate from the fixed and rigid system to part of the system, part of something which is fluid and dynamic, which together becomes a living, creative collective capable of finding ways forward and affecting positive change. When we see ourselves as part of the system, rather than banging up against a fixed and rigid thing that's over there and outside of us, we recognise our locus of control, realise our agency as parents and professionals, and can start to work together for solutions. The Posture Positive report recognises the challenges of postural care that both families and professionals have faced during lockdown. Some of this is difficult to manage, but the resilience and creativity of people over the last few months is both inspiring and challenging. For the system to change, we all have to recognise, parents and professionals, that we are part of it, that we have a level of agency and control, and that we can affect positive change when we start to view ourselves as part of that bigger collective.
Thank you, Lucy.
Okay.
For a sort of second then, I thought Sarah was going to stay on mute and then I could just keep talking.
No such
without
chance. No way. Now, Lucy talked a bit about the locus of control, and I must admit, for a while, I was thinking about like the grasshopper of positivity, and it turns out it's locus and not locust, and I will admit that I said it to a few people. I'm learning all about my locus of control. It's about what we can change. So we're going to share with you now. We have developed a rapid fire set of questions which we can use with people to get to the heart of things they have changed within their services that have made an improvement,
within their family.
Or within their families, or well, within your locus of control.
Locust, in your grasshopper of control.
In your grasshopper of control.
How have you embraced the insect within you?
Exactly. And we're losing it now. So what we're gonna hand over to the ever professional Michelle Baylis, who was so kind and gave up some of her time to have a go at doing this. She was nearly there.
Oh, she's coming. You ready?
Right.
Ready?
We're ready. Over to you.
Okay, go.
Over to you.
Hello, I'm Rachel and welcome to Posture Positive, a collective of voices and hopefully action changing the future of postural care. This is our rapid fire question round. Please will you introduce yourself and tell us what you do?
Hello, my name's Michelle Baylis and I'm a paediatric physiotherapist. I'm currently the clinical lead for Birmingham Community Healthcare, Community Services Paediatric Physio.
Fantastic, Michelle. Thank you so much for joining us. Right, this is it. Are you ready for the rapid fire round? Yes.
I'll try.
You look like you're just about to go start a roller coaster. Okay, here we go. Starter and main or main and pudding?
Starter and main.
Thinking about every aspect of your life, personal, professional, whatever that might be, what is the best thing to come out of lockdown?
Probably in the summer, getting all our garden projects completed.
Very good. In 3 words, what is postural care to you?
So postural care is protecting body shape.
Fantastic. Why do you think it's important?
It's very important because without correct symmetry and body shape, then young people could be in pain, they lose function, they lose sleep at night. The whole family then loses sleep at night, so it's important to be able to move freely as best you can, to be as active as you can, and to stay comfortable and functional.
Fantastic. What new ways of doing things did you introduce during COVID-19?
So our team, we set up an advice line for families and for anybody who had a concern about a child who was already referred to our service. So we had quite a lot of calls about postural care and equipment actually. So it's manned every day, Monday to Friday, by a physiotherapist, a qualified therapist, and they were able to basically give some clinical advice, triage. If there were any cases where we thought, actually, we need to go and see this child, then it was the line that they could call and have that conversation, that decision could be made. We opened the advice line, which was brand new and has worked really well.
Fantastic. And how did that go down with the people around you?
I think it was, it felt like it was a challenge to start with in the team, but then because a lot of our staff have been redeployed to adult services, so we were very depleted and we were doing a lot less contacts with patients. But we were also working from home quite a lot, so it meant that actually it was a clinical job they could do from home. So it actually went down in the end quite well, even though it was challenging to start with because it was new. But the responses we got from families and from other health professionals who called the line have all been very positive. So the fact that they could speak to a clinician with their questions and their queries came back very positively.
Fantastic. So, someone who's thinking about doing the same thing, what advice would you give them as they're just about to start off on an advice line adventure?
Well, I think, just being prepared for, we're still learning. we're still using it, and we're realizing that we should probably have written everything down before we started as to what to do in this scenario and what to do in that scenario. So I guess a little bit of planning, learn from other people, because we were copying OT and SLT in our team who've already got advice lines up and running for various reasons. But so yeah, learn from other people, copy what they've done, rally the team around, because it's still literally how we're running it at the moment. The therapists are volunteering their days to do it, so we will be timetabling it in future, but currently we're still relying on the staff to volunteer for it. So yeah, just giving them the support they need, to give them some scenarios, sort of give them some information on what kind of things to expect at school and what sort of advice they can give to families.
That's really helpful, and we will be dropping in the blurb at the bottom of this YouTube clip. We'll be giving any information that you can share with regards to doing that. That's fantastic. Okay, in your last question, in your postural care role, what 2 things would make a really big difference to you?
In my postural care role, well, I think throughout the pandemic, we've actually stayed seeing patients. The big thing that make a difference to me is just have more therapists to see more patients would be the first one.
That sounds universal, but yes, that sounds great.
And then I guess just that everybody who's involved in a child understands what postural care is and how important it is, really. So that education of everybody around the child, so it's not always on just a therapist's hands to solve a problem or help a child. So education.
Fantastic. That's a really good, that's really wonderful. That's something that came out of the Postural Positive report that we did, about that key thing about it not just being, like you say, the responsibility of one, but when we're all doing it, whether that's other allied healthcare professionals or families or paid support workers, whatever. Thank you so much, Michelle. That's been fantastic, really helpful. If you're watching, subscribe. It's probably here and here for the Postural Positive Collective YouTube channel. See us on Facebook and Twitter. Goodbye from me.
And thank you very much. Bye-bye.
Goodbye. Thank you, Michelle, so much. I know you are, we've seen you in the chat this morning. Thank you for offering to do that for us. So exciting to see that silver linings that we said, that resilience that people have shown within a really, really difficult time. Oh. So where we're at, we've not got long left. We're doing short and sweet, a bit like Sarah and I, both vertically challenged slightly, but we both like cake. I'm not going to say we're sweet as in we're nice, but we both, every time I've had a Zoom meeting with this woman, she's been eating things.
Permanently.
Just saying, carbohydrate central. So what are we going to do about it now? Please go onto the website, posturepositive.co.uk, and find out more information about the report. The full report is on there. It looks beautiful. You can go on there. There will be a summary, a much easier to read, bear down, shortened version for you to see in the coming days, and that also will be on the website. We have got lots of other ideas, and we really hope some of them fail. Sarah, what do you think?
Absolutely, because if they don't fail, if we don't have some failures, then we're not being adventurous enough, frankly. If we're playing it safe, then, you know, kind of, if every single thing we do succeeds, then, you know, we're just not, it doesn't cut it. We are going to leave you with the fabulous Brené Brown.
We are, but I'm just going to explain what these beautiful things are on here. You know, Sarah just wanted to go straight to Brené.
Go on, do it.
Well, I'm going to say, so the things that we've thought of so far, we have Posture Positive Facebook, which I set up, and so it's spelt properly. Okay? And that link for the Posture Positive Facebook will be on your chat, that you can go over there and say you want to be part of the Posture Positive Collective, those voices of people who are passionate about and whose lives are affected by postural care. Then there is the Twitter, which Sarah set up. So if you want to do that, you've got to do it with like a slight spell check. It's posture positive, rather than positive, it's posture positive, but it's better than collective PP. So we'll just go with that. And then we're going to go over to the Padlet in about 5-10 minutes. And there is, Padlet is just a link. The website address will be again on your chat now. Click onto that thing and we will be having a live chat, so you can ask us questions about the report, you can give us suggestions, you can tell us inspiring things that you've been doing. There's big things, there's little things. And there is the YouTube channel, the Posture Positive Collective YouTube channel, with videos like Michelle's. Sarah and I have done a rapid question. There's some animations that we've done working together, and Sarah is now going to leave you with good old Brené.
Okay, so those of you that don't know Brené Brown, hopefully after this session you will head over there and have a listen to her. Don't go there straight away, come to the Padlet first and talk with us. But it just comes back, really, we wanted to share, this is something that she talks about a lot, about having a strong back, a soft front and a wild heart. So if we are, as a collective, the people on this webinar are the system. So there are therapists, there's people from industry, there's practitioners, most importantly, there's families. We are the collective system, and we need a strong back and to have really strong values, to, you know, to have integrity, and not shy away from really difficult conversations. We need a soft front. We need to be aware of our shared humanity, that we are all vulnerable and that we will all make mistakes, but that we have confidence that everybody is doing their best. And finally, you have to have a wild heart. So you have to take risks, you have to be brave, and you have to stick with that, you know, stick with your strong back and your soft front. Now, we are finishing off here, so hopefully you will just get to see our two lovely faces, but we are finishing off here. We're not going to close the webinar because we're going to leave the chat open. So just for 5-10 minutes, we're going to leave the chat open for people to, what we would really love is for people who are doing things that they would like to share in a rapid fire, for people to leave their details so that we can get in touch with them. And it doesn't have to be something that absolutely has dramatically changed your system. Just things, or your family, or things that you are doing at home in order to improve the postural care that you are providing to your child and to the person that you love. So if you would like to do one of those, please put it up into the chat. We're going to go to the Padlet. The Padlet link has been shared in the chat. If you haven't been to Padlet before, don't panic, it's dead easy. We have Mindy Silver to thank for Padlet. Those of you who know Mindy will know that she's the technical goddess of all things therapy. And thank you ever so much for coming along today. Thank you, Rachel, for your company constantly for the past 3 months. I look forward to the next 3 months and seeing what we do next. And thank you, everybody, for your time this morning and for whatever happens next.
Thank you. Bye.
Bye.